Simon Muchara Kigondu. Dr. Simon Muchara Kigondu is the Secretary General of Kenya Medical Association. Okay. He is a consultant obstetrician practicing in Kenya. He did his undergraduate and master's studies from the University of Nairobi. Despite being an obstetrician and gynecologist, he has interest in universal health coverage for all and social protection, especially for senior citizens. So without further ado, I would like to invite our next speaker, flown all the way from Kenya, Dr. Simon.
Thank you very much. I would like to take this opportunity to thank the Malaysian Medical Association for this invite. My first contact with Malaysian Medical Association was in 2017 through a World Medical Association sponsored training of caring physicians of the world, where I met Dr. Arasu, some of you may know him, and Dr. Arvidan, who took me to a great dinner yesterday night, and I enjoyed Malaysian cuisine. And I am the Secretary General of the Kenya Medical Association, among many other hats. I'm a consultant obstetrician gynecologist working in Kenya. The Kenya Medical Association is a voluntary national medical association for doctors and dentists, whose twin mission is improving doctors' welfare and ensuring quality health care for all Kenyans. It holds its annual scientific conference for the last 50 years. And in our last conference, the theme was health across the lifespan, a focus on aging. That's a new topic in our country because we are a relatively not so old population. 3% of our population, it's going now towards 3%, where now we are starting to say we are having a population, and according to Arafa, he's called Arafa, the previous presenter? Zaha, we are not yet in one of your categories of aging population. Soon will be, yes. Kenya is a country in Africa. Malaysia is on that side of the map. This is Africa. It's in the central part of the east coast of Africa. And it is about double the size of Malaysia. And it borders Ethiopia, Sudan, Somalia, and a country called Uganda on the west. It has 400 kilometers of the Indian Ocean. And it has two distinct altitudes, lowlands and uplands, and has many lakes, inland lakes. It has 7 distinct ecological zones, and 82% of the country is arid and semi-arid. And that means sometimes food can be a problem for some of the population. The people of Kenya are in 43 ethno-linguistic groups, and they are originally settled in clusters with a common language and cultural practices. And the situation has rapidly changed, I think, like in Malaysia, due to political climate that favors free association, settlement, and freedom of trade and occupation. That means there is more urbanization. And there's still the ancestry, and this is important, and land heritage holds people of common ethnic and cultural backgrounds together, leading to ethnic clustering. We now go to a typical obituary in Kenya, a very different kind of presentation. Janet Moshiko Kamau is my grandmother-in-law. She is the mother to my wife, and my wife is right here. She's called Esther Wangui Moshara. She was born in 1924 in a village in Githunguri called Geteti, and she had one brother and one sister. Growing up, she was a farmer. Where she lives, they do farming. And her education started in 1935, but she's one of my inspiration. So when I interviewed her, she said she went to school for 4 days. And when she saw boys meeting girls, she went back home. The concept of boys meeting girls was new to her. That's how old she was. She got married in Kikuyu customary marriage. Kikuyu is one of the tribes in Kenya. She had 11 children, very important in our discussion today. 5 boys and 6 girls, but those were not the pregnancies. She actually, I don't think, ever got her periods. She had 16 pregnancies. Some got lost along the way. She worked as a farmer. Tea and coffee are important cash crops in Kenya, introduced by the British. And she had great cows. She went to church, also important in talk. AIPCK is one of the Christian churches in Githunguri where she lived. She was a social, in her life she was loved by all. And I came to meet her later on in life because personally I didn't have a grandmother to talk to. So when I was old, I met this old lady who was very brilliant, was very positive about life. And in my YouTube page, I have featured a lot of her before she passed on at the age of 93 years. So for me, this is a typical example of what old age should be. She was happy all the way. She's there, right there. This is where she was. That's, sorry about that. Oh, is that front, back? I want to go back. How do I go back? This is very serious. How do I go back? Yeah, that picture. Thank you. Sorry about that. But in that photo, that's my wedding. She was there. She gave, in 2005, that's her brother, her son. Her son is right there. And that's the grandchildren. She had, by the time we were counting, 60 grandchildren. Yeah? So it's atypical now. That comes, the lifespan of a Kenyan has recently improved. It was as low as 42. And it is classified as about 63. And so I have about 20 years to go. But it was shorter due to a lot of issues. For a lady like that grandmother of mine to live 93 years old, her mindset was very positive on aging. Having interacted with her, she brings out some of the aspects of a positive mindset that has enabled her to live a quality life for that long. There are several factors that go hand in hand with a positive mindset to facilitate good quality of life for the aging. What you are saying is that it's not, even if you think positively and certain factors are not in place, then your positive mindset may not help you live a quality life for long. So we must look at a positive mindset in the light of the other factors that lead to a positive mindset. So economic, security, health, and disability, living conditions in old age are concerns around the world. Hence we have this conference. The nature of problem differs considerably from continent to continent and in the country, in between countries. In Sub-Saharan Africa, where Kenya is, the older people make up a relatively small fraction of the total population, as you have said. In Kenya, it would be about 3%. I saw in Malaysia, 7%. And their main support has been the household and family, supplemented in many cases by other informal mechanisms, such as kinship networks and mutual societies. Older people in Sub-Saharan Kenya have traditionally been viewed in positive light, and they as repositories of information and wisdom. If I wanted to know what happened in 1948, for instance, I was not there, but the older person would tell us, maybe there was a drought, this is how we handled it. So they are repositories of information and wisdom. And while African families are generally still intact, and development and modernization are closely connected with social and economic changes that weaken the traditional social values, they provide support and care in later life. Formal education might be a good thing, but also a bad thing in terms of caring for the aged, leads to greater independence and autonomy, and weakening of traditional social ties and obligations and factors tends to undermine the traditional extended family systems. As we said, human beings are social people who like to survive in groups, but with people becoming more individual, it becomes an issue. So the challenges facing older persons has been highlighted in the conference include poverty, exclusion, neglect, loneliness, especially due to increased individualism in society, abuse, poor health and nutrition, the impact of diseases, especially the burden of caring for diseases and orphans, physically challenged persons, as we heard about the streets, inability to cross the road quickly yesterday, traditional cultural practices which might discriminate older people, and discrimination, especially in employment. They say that you first retirement age, insurance beyond 35, you can't be insured, and lack of information about their rights. Intergenerational gaps leading to misunderstandings with the youth and inadequate social security and protection. So my topic was a positive mindset in aging. A mindset is an attitude or a disposition or a mood. An intention or an inclination, that is a dictionary definition. Now, when I think about it, I say a positive mindset is an established set of attitudes held by someone. So when we say someone has a positive mindset, it means that they have a positive attitude towards aging. What is your attitude towards the aging process? That is actually the big question that is being asked. Do you look at growing old as a positive rite of passage? Do you look at growing old as a negative phenomenon that must simply be endured? A positive mindset is therefore positive thinking to healthy aging. Yeah? Those two must be inherently combined. Aging is not lost to youth, but a new stage of opportunity. Betty Friedman was a philanthropist in America who died in 2010, but she was born in 1920. And she said, it's not lost youth. It's not that your youth is lost, but it's an opportunity to grow. Why are we having to discuss positive mindset in aging? It's because of an ageism phenomenon. Over time, this has distorted the view of aging, which has led to prejudice and discrimination based on one age. One result of the World Values Survey. World Values Survey is a survey of in 53 countries of about 83,000 people, where 60% of the survey respondents say they do not think older people are respected. And the lowest level of respect for older generations were reported in the higher income countries. That would be obvious because a lot of people leave home, but the lower income countries sort of tend to live in communities, and therefore they have more contact with the older people. I suppose Malaysia and Kenya fit into that gap. So luckily, we haven't reached the disrespect for older people. Ageism is extremely common, and most people are completely unaware of the subconscious stereotypes that they have about ageism. You may not know that you are biased against the old, but it is very common. So the way of thinking about ageism is depicting older people as frail. That old man is very weak, or dependent, or out of touch with media. Discriminatory practices such as healthcare rationing by the age. Yesterday in a presentation there, one old lady said she fractured her femur, and when she went to hospital she was told she's 60 years, therefore they cannot put her. But that is ageism, you see? Yeah? Institution. She was 55 even. They say she's too old to be put up in. That is ageism, saying that you cannot get treated because you are 55 years old. So institutional policies such as mandatory retirement age, then that is also some form of ageism. Recently researchers have identified that having positive self-perceptions about the benefits of getting older can create a self-fulfilling prophecy by helping someone stay mentally, physically, and psychologically younger. That's very significant. If you can think yourself into physical, mental, and emotional health, then you can as well think positively. There is no need of being negative. Aging studies have found a strong correlation between negative perceptions about aging and physical frailty. I mean, if you think you're weak, you become weak. Yeah? If you think the physical frailty in older age is associated with lower cognitive abilities. That's even worse. Now, you are thinking, you have negative thinking, and therefore your thinking actually becomes weak, you know? And when compared to the peers who are less frail in older age, frailty appears to be a trigger effect, to trigger a domino effect that cascades to dementia. So you think you're weak, you become weak and become demented. So you can as well think positively. I think positive mindset is very important. So perception of aging can lead to frailty and cognitive disabilities. The Irish have done a lot of studies on aging, and 3 key findings from the study on aging by Tilda. Older adults with negative attitudes towards aging had slower walking space. So if you have a negative attitude, when you see 2 of them, one is walking faster and the other one is walking slower, the one who is walking faster has a positive attitude. And worse cognitive abilities, 2 years later, they actually did a study. So these are difficult studies to do in aging. This was true even when participants' medications, mood, and life circumstances and other health challenges that occurred in the same 2-year period. So they followed old people over 2 years, and so that those who had, and they took the measures, they say positive attitude, negative attitude. Those who had positive attitude were walking faster and had more cognitive. Those who had negative attitude, then they were worse off. Furthermore, they said the negative attitudes towards aging seem to affect how different health conditions interacted. And I think we had an example yesterday by the ophthalmologist who said that her patients who had a positive outlook of life had better outcomes for the same surgery in the eye than those. She said that anyone with a negative attitude is likely not to get better from her treatment. And I think that is because of that positive mindset. Frail older adults are at least of multiple health problems, including worse conditions. The Irish study sampled frail participants with negative attitudes towards the aging process who had worse cognition compared with those who were not frail. Self-perceptions about aging are important predictors of physical and cognitive functions in later life. If there is anything you are to leave out of this talk, is that self-perceptions about aging are important predictors of physical, you become weak if you think negatively, and cognitive, you become more foolish. Cognitive is, I suppose, function later in life. So the benefits of a positive mindset include the add years to life. Actually, they said, they compared 2 people, the Irish studies did a study, they say 7.5 years more for those who had a positive mindset. They reduce your stress, they improve immunity, lower levels of inflammation, lower risk of heart disease. So a positive attitude toward aging is important for health through the aging process. I can stop there, but let me just continue a bit. The blue zones, Batner, in a famous talk on how to live 100+ years, went on to study a place where they found the highest number of octogenarians. Octogenarians are found in Sardinia. You know them, the 7, there's termed blue zones. Okinawa on this side of the divide, yeah? And they looked at which factors are these octogenarians plus are having, and they went through and they summarized the features on which those people had. And one was that they moved naturally, as opposed to doing exercise, meaning that every day you just walk, sit, stand, yeah? They had purpose. They managed their stress very well. They controlled their weight. There was a way they eat the food. You have to walk somewhere to get the food, and yeah, you get, so that you don't overeat. They ate more plant seeds. Yes, there was a bit of meat in 1 or 2 of them, but a lot of the plant things that I'm seeing around here, I think Malaysians is a blue zone, is Malaysia. Eh? Some had wine at about 5 o'clock with the food. Yeah, wine at 5 o'clock, some had. These are studies that they analyze those octogenarians, not drunkenness, but you know, tasting. I had a bit of Malaysian rice wine. they belong to a certain community, you know, they belong. And they love their loved ones first, meaning the family, yeah? And right tribe, yeah? Right tribe sort of mean you interact with the people you have like a common, what is it called? Commonality, some form of commonality with it, yeah? Yeah. The positive mindset is the purpose. You wake up every day knowing that you're going to do something with your life, yeah? So that is the positive side. But these were the features of the so-called blue zones, yeah? A lot of policies have been done in terms of addressing aging. And in 2002, there was a Madrid Plan of Action on Aging and had 3 priority areas. The older persons and development was one of them, advancing health and well-being of the old age, ensuring enabling and supportive environments. All these have been addressed in this very fantastic conference, and we thank the organizers. So positive aging can be looked at individual level, societal level, and what the government needs to do. Adopting a positive view of aging as a healthy, normal part of life is the mindset that will do whatever is needed in order to continue doing the things that you love, that are important as you grow old. As we said again, that is the lesson of this day. At a society level, we need to enable the seniors to embrace positive aging and to continue pursuing their passions. At a government level, we need to enact health and social policies that facilitates the pursuits of the older citizens. Some of the African values that protect against ageism, as I said, in Africa, we respect the older person a lot, include kinship, sharing, solidarity, and having a common good. This common good is what seems to be getting lost in the world today. Common good. People seem to, you want to accumulate things for yourself. But common good is one of the values that protects against ageism. The policy priorities, therefore, to address, to help people get a positive mindset in aging include poverty. You must ensure that the older persons have access to assets to be able to survive in their old age. And I think the financial talk that we had there was one of the ways of doing that. Laws must, and human rights must be protected, such that you enact laws that protect the older person. Families and culture must be embraced, because it is in the context of the family that the older person is taken care of very well. The health needs, of course, of the older person must be taken care of. You must ensure that the older person have access to food security and nutrition. And they have good housing and physical amenities. And as the architect said, you have access, like they cannot go upstairs, so you have railings for older people to go upstairs. Good design of housing so that they are able to survive well. Education and training. Education is lifelong. Conflicts and disasters. How do old people get engaged during conflicts and disasters? The media, very important. The media must show a positive image of the elderly. A lot of things the media does that are negative lead to negative mindsets of everyone else, so that everyone fears being old, because the media portrays the old as disaster or something. So the media must be encouraged to. Older people must have access to water and sanitation, and we must protect our environment to do that. And we must involve the older person in the country. This last slide is taken from a study done from the Kenya government cash transfer program. In Kenya, the older person above 65 years gets a cash transfer because they have identified poverty as one of the reasons that leads to poor quality of life of the elderly. So the study was done in Garissa by Adam Mohammed. The study concluded that cash recipients of cash transfers had the greatest impact of older persons. So Dr. Manfred Diel in Colorado studies a lot of aging, and he suggested these 9 steps for positive aging. Stay physically active, have brain exercises, adopt an overall healthy lifestyle, stay connected to other people, create positive emotions for yourself, accept what you cannot do, and ask for help for what is needed. Set goals for yourself, minimize life stresses, and have regular medical checkups, similar to the blue zone kind of lessons. And that fellow, this is what you need to, every time you look at the mirror, you need to be growing younger. Yeah? I believe if I refuse, I can stay old. Mark Twain once said that age is an issue of mind over matter. If you don't mind, it doesn't matter. Yeah? And I think that is a very apt statement to complete. Thank you very much for allowing me to present you.
Thank you very much, Dr. Simon, for a very interesting topic. We have learned something about Kenya, right, today? Yeah, and in fact, what he shared does not only apply to those going into the aging process. It actually can be applied in our daily practice as well, right? So, for our next and the last speaker for this symposium this morning, I would like to introduce our one, no other, Mrs. Jamjit Singh, who is also known as Mrs. J. Okay, she is actually an educationist by profession, but she has moved